If your chronic knee pain is now turning into chronic low back pain, then you need to stop and watch this video because I'm going to share with you why you may have a much bigger problem on your hands than just knee pain or low back pain. Hey, I'm Dr. Sam McDonald. I'm a brain health expert, and this channel is dedicated to helping you rewire your brain so that you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So the first thing to understand is that all pain begins in the brain. So if you have a knee pain problem, a low back pain problem, a shoulder pain problem, regardless of whatever joint or body part it is, understand that this pain is all coming and being registered up in the brain. Now, yes, you can have certain instances where you maybe have trauma or degeneration to a particular joint that can accelerate this process and make it much more problematic. However, all pain begins in the brain. So let's go through this pathway a little bit to understand. So the knee is the largest joint in the body. And in fact, whenever you go downstairs, 346% of your body weight goes through that knee joint on each and every step. So trauma, degeneration, and inflammation, they can all accelerate the process of this knee breakdown, which, yes, biomechanically can start to alter things through the hip and into the low back. And yes, it can start to cause problems with asymmetry of movement, or it can cause accelerated breakdown in the joints on a biomechanical sense. But understand, you're also going to have a much bigger problem on your hands too, because the body does not work just in one isolated segment, meaning it doesn't work just in a biomechanical sense. It's also going to work in multiple other lenses too. So we have to look at all that. So now if we're going to look at the low back, there are 5 different nerves that come out of the low back or the lumbar spine that innervate all the way down from our low back to our feet. And specifically, 4 of those nerves are going to control knee function. So that's really important because now we're just talking biomechanics for a second. If you have problems now impinging on those nerves that are altering communication, coming down to the muscles that coordinate the function of the knee, you're going to have accelerated breakdown and pain in that knee joint that's coming from the low back, with possible referral pain into the low back. Now, just for a second, let's now look at all 5 nerves that come out of the low back and understand that those nerves also control and communicate to the organs of elimination, digestion, and reproduction. So if you have problems with diarrhea, constipation, acid reflux, ED, or incontinence, or any other host of issues found in this particular area of the body, then understand that now you have major issues coming from those nerves to those particular organs. This, again, is not going to stay localized in this area. This is going to kickstart a chronic inflammation cycle, which you're likely already in because of this chronic knee pain. But this chronic inflammation cycle, again, is not going to stay local. It's going to go body-wide. And this is really important to understand because of one of the specific chemicals in this inflammation pathway. It's called interleukin-6. Interleukin-6 is going to move through the bloodstream, and at some point it's going to cross the blood-brain barrier. And now it's going to start to wreak havoc up in the brain. And 2 really important areas it's going to start to damage is your motor area, as well as the area of the brain responsible for focus, attention, and concentration. So as it starts to damage the motor area of the brain, you're going to have problems with balance and coordination. You're going to be more prone to falls, more prone to knocking things over and injuring yourself. And now you're going to have problems with focus, attention, and concentration, which means if you're a person who either loses your phone, keys, wallet throughout the day, or if you're a person who loses their train of thought more than 2 times a day in conversation, you're already in stage 2 Alzheimer's. So all this started from a problem with the knee causing pain to the low back. But you can quickly see how if you don't have a good understanding of what's going on with the rest of the body, or the person that's taking care of you doesn't have a good understanding of what's going on with the rest of the body, you could be stuck in these chronic pain cycles for years and years and years and years, all because they're only hyper-focused on saying, hey, there's nothing biomechanically wrong with the knee joint, or hey, looks like it's bone on bone, so you need to get that knee replaced, but you're not addressing all these other problems that are going on that's keeping you from being pain-free and keeping as healthy as you can be. So on that note, you should be healthy by choice, not by chance, and for that reason, I will see you on the next video.